And look what page I happen to have up already.
Roman, can you hear us? Yes, okay.
Yes, I can.
I think you're good to go.
Can you hear me?
Yes, we can hear you great.
Is my face giant?
Nope.
Good.
Not any more than usual.
What did he ask?
If his face was giant.
Oh.
I just picture myself as like the dude from Wizard of Oz, like on a giant screen. I don't know.
Max headroom.
Don't look behind the curtain. All right, it's 5 o'clock. Call to order the work session, behavioral health needs presentation from the Gunnison Valley Health Coalition.
Yes.
It's not. I don't need it. Just wondering.
So my name is John Powell. I'm the Data and Communications Coordinator for Juvenile Services. And we worked on this project for the last 9 months, starting somewhere between mid 2021 until March of this year. And we started these, the leadership, Health Coalition leadership started conversations in late 2020 around concerns about behavioral health in our community, and really wanted to really understand what behavioral health means in our community. And so the Health Coalition commissioned the report to better understand and really talk to community members about what behavioral health looks like in our community and what really the needs and gaps are. So this study looked at over 50 different quantitative data sources, and I conducted over 43 key informant interviews with people around the community. Next slide, please. Yeah, so we really wanted to understand what behavioral health is, and behavioral health, for the purpose of this study, is looking at environmental factors. So very much so, behavioral health is like an ecosystem where every tree, every rock, every river plays an integral role in the health of the other pieces in that ecosystem. And so we wanted to look at how the environmental factors, including housing, food insecurity, access to services, cost of childcare, how those impacted people's physical and mental health outcomes. And what we kind of uncovered is that a lot of the issues that we've seen in our community are chronic in nature. I like to explain it like a stress fracture, maybe where a long distance runner has pain in their foot and they kind of ignore that for a long time, and then eventually it leads to a broken foot and they are unable to continue running. And I think that's kind of what COVID-19 was for our community. It was a stress fracture. We did do, in beginning this process, I did conduct, review a ton of literature to kind of give us some baseline information. And we do have a full report, and I would point you to the full report, or at least the executive summary, to get some of those pieces. That can be found on the Gunnison County Health Coalition website. So as part of the interviews, I did conduct over 43 interviews with people around the community, and some of the main themes that arose from those discussions were delaying or not seeking help or support or treatment. And there are various reasons of why people are not seeking treatment in our community, but it depends on each population. Some people feel stigmatized. Some people cannot access that because of cost. Some people just feel like it is a sterile environment that they do not want to walk into, and they can't really relate to any kind of therapist or any kind of person that's serving people in that capacity. Another piece that came up is living environments. Obviously, affordable housing did come up in almost every single conversation, but what was surprising to me is that the idea of psychologically and physically safe places to live came up as well. So even though people might have housing, the fact that maybe they're returning to a place that got them into trouble in the first place, or maybe the thought of like having their rent increase, or as we have seen in Country Meadows, land being sold out from underneath people was definitely a concern. And that's a trend that we're seeing not only in our communities, but across the United States, as mobile homes are old and sometimes very worn down, and people do not have many options as far as affordable housing or safe housing. And another piece that we'll get into a little bit later is the idea of kind of high density housing where people are a little bit more visible to their neighbors, which has impacts on them, maybe getting re-involved with law enforcement, et cetera. Another piece is reoccurrence into systems, this recidivism. When speaking with members from the judicial system, from law enforcement to people working at the jail, it became evident that there's a sense of frustration amongst people who are dealing with the same clientele over and over, and not really understanding why the system is failing these people and what we can do to rethink how we are serving these members that are reoccurring into these systems. Next slide, please. I'll turn it over to Jeff now.
And know all of you, and I've seen you in different capacities. Some of the work I've done elsewhere in Colorado with John's help. We met each other 4 years ago, and he's worked with me on some housing studies and some other health studies and other parts of the state. And so he asked me to join him on this one and help out. It was a pretty big undertaking. Part of our mandate was to gather all the data, so hence the 50 data sets, which were required to triangulate some of the numbers, which, for example, you'll see just how bad is, substance abuse, how prevalent is it in the community. I'll put the glasses on, try and read over there, but the nexus is really, and to skip to the punchline, is financial stress creates poor behavioral health outcomes. When we started gathering some of the data, after some of the initial conversations, we thought we were going to see some charts where the substance abuse was spiking, and certainly we do see at the emergency room some severe cases spiking in the community. But overall, what we tended to see was just a high level of stress and poor mental health, and kind of a chronic nature of substance and alcohol abuse. And so we started looking at, a little deeper to what drives that, which took us into the realm of the housing and the economy and the socioeconomics. Next slide. So the Gunnison County, the incomes are relatively low relative to the high cost. And like say, I go to the grocery store here when I'm on the East Coast, Cheerios cost the same in both places, but here the housing and the healthcare and the childcare are really high. You have healthcare premiums more than a mortgage, and probably that every day. And those two together probably add up to the median. A lot of people, once you check those couple boxes, you're stressed. I'll use the old-fashioned paper here.
Can you hear this mic? Maybe hold it a little lower than I did.
Yeah, thank you. I was actually just about to write in the chat. Once the speaker walks away from the podium, it becomes really difficult to hear. So your mic is great.
Hi, Roman. We're happy to be the guinea pig.
Hi, it's very loud now.
So and one of the things about the healthcare sector of our economy is that over the last 10 years, the incomes of healthcare providers has grown less than any other of about 16 sectors measured by the State Department of Local Affairs. So we don't have as many healthcare providers in the county, and they're especially struggling to make ends meet. Next slide. Median income in Gunnison County about 56,000, higher at the north end, a little lower at the south end, but below the state average, which is 72,000. And in service sector, which dominates our county's economy with tourism, the levels are lower. So one of the findings have in the report is that the number of people working more than one job has increased in recent years. So if you're not able to make ends meet with one job, you get a second. Can't make it work with two, you get a third. And what Carrie would say if she was here, one of the authors as well, is that creates trade-offs for families. So, you know, you're not home when the kids get home from school. You don't make it to the child's concert. You're not there when your spouse is there. You're not spending time together, which leads to stress parenting and further behavioral health comes as a domino effect. Next slide. So as I mentioned, there's a consistency across the county, and we like going back to 2010 and looking at things well before COVID, and in fact, to the beginning of really a decade of economic expansion. The blue, this chart shows a couple interesting points. One, the blue at the bottom is the percent of households in the county that are earning less than $25,000 a year as measured by the US Census. And that's about 20%. You can see a little bit of variation there, but roughly a fifth of the people of the county didn't gain in the economic expansion, not even a change in and around COVID. Meanwhile, the households earning more than $75,000 increased from roughly 30% to 40% over the last decade. So another way to put this is increasing income disparity in our community. And really, I think the challenge for policymakers in the county is, how can we, essentially raise the incomes of those at the lower end of the income spectrum. Next slide. The U.S. Census, I learned this doing the report, the federal poverty level, which we probably all heard about at one point or another, dates back to 1963, and basically the cost of food at that time. And they put together the index for and measurements for the federal poverty level, and then every year since then they've extrapolated forward. And by most expert opinion, the federal poverty level underestimates true poverty. At the University of Washington, the Center for Women's Health has done quite a bit of work nationwide on call it the true cost of living, what they call the self-sufficiency standard. They look at food, housing, transportation, other basic forms of it's not including vacations or expensive mountain bikes. And what are those costs on a per county basis around the nation? And we looked at information, which was cost information. We looked at other data. Jen and I took a couple approaches to estimating what portion of our county fell within below the self-sufficiency level, and we came up with 30 to 46%. Since then, the UW, along with Colorado Law and Policy Center, came up with their estimate, which was in the high 20s, I think 27, 28%, close to our lower estimate. So a little less than a third of the county is struggling to be self-sufficient. Slide. This graph depicts the difference between those under the federal poverty level, which is the blue, about 13% of the county in 2019, and the red, which is above that lowest level, but still not self-sufficient. And those are the people who are less likely to qualify for assistance, whether it's state or federal, and that's where it's even the most stressful. Next slide. Housing, with the housing needs assessment, but as John learned in the key informant interviews, housing came up in every interview. So we felt we needed to rest it in the report. If you go back and look at the housing needs assessment, which have been conducted, we found that the oldest one we found was dated 1992 by Melanie Reese, who was involved in later needs assessment, quite well respected. And then since then up through the most recent update done by Willa Williford and her colleagues. Every year that if you look at the consistent metrics that appear in all the needs assessments, it tends to get a little worse every time we do a needs. Great Recession. This was pointed out by Chris Akers, a state economist with DOLA. During the Great Recession, housing construction came to a stop in Gunnison County. And yet population didn't rose at about 1% a year in the county. So through that, really about a 6 to 10 year period, housing construction was at a very low level and population continued to grow at the same. That's really where the most recent crisis kind of dates back to with just not having enough the population. Next slide. And so if we take those not historic, but back to 2010 growth rates forward, we do see the problem expanding into the future. We really put this in there for policymakers to look at not just now and where things are at, but solve the problem over time for the longer run. And I don't want this to imply that what the solution is, and it's not necessarily building more units, but it's trying to get that balance between the number of people who live in the county and the number of places for them to live, so that John likes to tell is somebody described their housing, living in a house on stilts over shark infested waters. There was a unit and there was a number on the chart, but it wasn't the kind of place where, after you've been in rehab or jail, that if you go to back on track. So next slide.
It's jail then rehab, by the way. It's jail then rehab.
Where I'm not. Rental rates, we had some data actually from the Gunnison Times going back to 2012. On average, rental prices, this was for the city of Gunnison, expected similar around the country, but they went up on an annual average of about 8% a year. And no, not too many people, if any's incomes, people aren't getting an 8% a year raise on average, especially going back to 2012. So the number of people, over half the renters are spending more than a third of their income on rent. But this just shows a correlation, and I'll say correlation isn't causation, but it's interesting to see how the number of people going to the Center for Mental Health, so the measure of new visits to the Center for Mental Health is pretty well correlated in terms of a rate of growth with the increase in housing, whether it's home values or rental rates indexed there in the red. The meanwhile, median income in the county growing, but at a much lower rate. So over time, it's global warming. It's slowly getting worse in terms of the affordability. Incomes aren't growing at the same rate as costs. Next slide. And the result is poor mental health outcomes. I think we'll look back, at least from a tax revenue standpoint, and see that COVID was really a blip. If you look at some of the charts in the report, some of which come from Mount Cresta Butte, it's almost hard to see where COVID was and tax revenues. Next slide.
This is a chart showing behavioral health related admissions to the emergency department from 2018 to 2021 at GVH. If we look from the end of 2020 to the end of 2021, there was an over 200% increase in behavioral health related visits to the emergency department. Of those visits in the last of that year, end of 2020 to the end of 2021, over half of them were substance related. And of those substance related ones, roughly 40% of them were strictly alcohol related, but substance related also means overdosing, withdrawals, etc. And then of those visits in that last year, roughly 20% of them were strictly mental health related. So suicide ideation, psychosis, things of that nature, schizophrenia, things of that nature. To address this problem, GBH introduced the mobile crisis unit in July of last year, July of 2021. And mobile crisis team is getting calls to people's locations to help meet them where they are in the community, so they're not having to make the trip to the hospital. And the main reasons that people are utilizing that services are suicide ideation and other mental health issues. And more recently, the hospital has seen their numbers start to decrease because of this service, which is encouraging. Next slide, please.
I think I'll go back up, and I mentioned, Carrie Comerford, if you know her, is one of the authors and the department head for the Gunnison County Juvenile Services. And part of her presentation of this information is to, say that we're not here to, bring you down and, depress you. That's not the intent, but it is sobering. I mean, we were charged with gathering all the data, interpreting it, coming up with, the narrative. And, having done that, this is really to scale the solutions to the problem. So if we have a big problem, the small solution isn't gonna cut it because it doesn't fit. We also think that it's maybe looking at some of these underlying causes and trying to address those is ultimately, treating the cause of the illness as opposed to the symptoms. So that's really where we're going with this, and starting a conversation that gets, elected officials such as yourselves and other community leaders having a conversation about the way things really are, as opposed to, not having that information. So with that, I'll continue with a few more estimates of some health data. As I said, things, when we started collecting the data, conducting the interviews, they didn't necessarily add up the way we thought or we might expect them to. So we looked at everything. Another survey that was done in the fall of 2019, just before COVID, was done by the West Central Public Health Partnership. And it was very comprehensive health survey. And we ended up with almost 400 surveys in Gunnison County, which for a population of, around 17,000 is a pretty good statistically valid sample. And when asked to rank the health, the health issue, the greatest health issue, the number one was mental health, followed by suicide at 74 and 73% respectively. And especially to see the suicide so high was really surprising. There's about 16 other things that, obesity and other ailments and health issues that people could have selected, but by far individuals in the community are mostly worried about mental health, and it's stress and depression, accessing the services and lack of insurance were also top ranking in terms of identified health needs. Next slide. They were also asked about community health issues, and here we see poverty as sort of the greatest concern, followed by domestic violence, which frankly surprised me. We're neighborhood I live in, I'm not exposed to that, and it's a lot of people felt that that's a real issue, and we see it elsewhere. Some of the health data John's going to talk about. Low education issues, or low education, was also seen as a primary community health issue. Next slide. I mentioned before the one of our charges was collecting all the data. One of the other charges was just, what is the extent or what is the prevalence of these issues in our community? I was on the Community Foundation's COVID Grant Relief Award Committee, and every couple of weeks, we would review grant applications through COVID, and, you know, we saw a lot of numbers floating around about how bad this problem was or that problem. And so the Community Foundation, which helped fund this study, really wanted to know, well, you know, just what does the data tell us? We found, again, through a couple ways of estimating and multiple data sets, that alcohol is really our greatest substance that's being misused in the community. 10 to 20% are drinking to the point where they should probably have treatment, or it's impairing their activities and their health, their behavioral health. Drug abuse, a little less, 5 to 15%, and mental health, 15 to 20%. And again, with mental health, a lot of that is depression. And again, we saw the chart with a pretty significant rate of growth of visits to the mental health center, really over growing over a 10-year period. Next slide. And the other was food insecurity, where, you know, the number of people who are essentially not, you know, nutrition is lacking or not getting enough to eat is 10 to 15%. And again, a lot of these were pretty consistent over time. Not, you know, there was some impact with COVID of things blipping up, but in general, these are consistent. There's a consistency about these issues in our county. Next. I'll turn it over to John.
Childcare is another point of concern that we looked at in the community. For parents with young children, if you have one young child, it almost doubles the cost of living in this community. So the two main takeaways from early childhood is that it's very expensive to have to find childcare, and childcare is very limited. There are a lot of open slots available across the community, formal childcare slots across the community. I think that's a good specification to make. And then also the lack of high quality early childhood and how that early childhood care and how that impacts parents. If parents are stressed about where their child is going to go, it leads to kind of this toxic stress or prolonged stress, ongoing stress that happens over weeks or months, and that can impact how they interact with their children, how they show up for their children, leading to traumatizing their children in some cases, re-traumatizing their children over long periods of time.
What happens with the 371 children under 5 without formal childcare? I mean, where are they?
That's a good question.
And what is formal childcare?
Formal childcare are certified centers like Tenderfoot Center, or places where people are credentialed to serve or to care for young children. Also, the new location, I can't remember the name of the location in Gunnison. It was the old senior living house, has been converted into formal childcare. So these people are credentialed by the state of Colorado to provide childcare in a setting where that is considered certified by the state of Colorado. What's happened? So parents are left to, kind of piecemeal that together, figure that out. Or sometimes they have a parent come in from out of the town, or maybe they have a parent living here that will watch their child. So it's kind of uncertain of where those pieces are. But I think there are efforts in the community to help some of those people who are informal childcare people to become credentialed through the state of Colorado as well. Next slide. We also looked at Western State Colorado University. There are several things that came up in the data. One of the most, I think, relevant things is that in the fall of 2021, roughly 138 students disclosed that they were struggling with, or they dropped out of college because they were struggling with mental health issues. And so that is roughly a $1.3 million loss for Western. And also in conversations, the idea of continuity of care came up as well. Students are coming to Western and they're leaving behind maybe some services that they had in their previous community, and they maybe stop taking their medication. They don't get connected to a therapist or other service providers in our community. And that is creating struggles for them in the long term. And maybe they're going back during Thanksgiving break and getting reconnected with their therapist, but really figuring out how we can connect students to services in the community once they come here. And there are efforts working to address that issue right now. Jeff has already touched on this a little bit, but really behavioral health impacts on youth. So we looked at 2 indicators. The first one was from Gunnison Valley Mentors, and their primary risk factor changed from 2020 to 2021. The most prominent risk factor previously for youth entering services at Gunnison Valley Mentors was poverty, but that now changed to domestic violence, where youth are experiencing some form of violence in the home, whether that's from their parents being violent towards each other or experience violence towards the child. And we also looked at Project Hope, where it saw nearly 80% increase in the overall number of clients between 2015 and 2021. And with Project Hope and some of these other indicators as well, as like the increase in numbers at the hospital, it's also important to recognize these organizations' ability to increase their capacity to serve more people in our community. So not only are we maybe seeing an increase from there being a higher need, but also the organization's ability to increase their capacity and serve more people. Next slide, please. We also looked at suicide data. If we look at suicide between 2004 and 2019, the #1 occupation for the highest suicide rate is the construction industry. If we look at a shorter time span between 2014 and 2019, the #1 occupation, or the occupation with the highest suicide rate, is the food and accommodation services. And when we were questioning, like, why are we seeing high suicide rates in these occupations? And when talking to people working in these industries, in the construction industry, it's more about pain management. And sometimes people are working long hours in the cold weather and they are struggling to have their needs met. There's not a lot of support in those industries as well in the construction industry. It's mostly male dominated industry, and getting males connected to services can be somewhat of a barrier in itself. We also know that in the food and accommodation services industry, substance abuse is highly prevalent. One person quoted saying, "We know that cocaine and alcohol abuse is very prevalent in the food and accommodation the service industry." And so how can we boost support for some of these people working long hours, maybe odd hours, maybe working outside where they are exposed to the elements, or maybe lifting heavy things all day and coming home and using substances to somewhat cope with their situations, I think is important. Western is also seen, I think this number has actually changed now. That's another thing is, as we're going through this process, the number of suicides in the last year has changed, and I've had to update the numbers, which is kind of a harsh reality of living in Gunnison County. But I think now it's 6 WCU students deaths since 2019. Youth who report binge drinking on the Healthy Kids survey report higher rates of suicide ideation at nearly twice the rate of those who do not report binge drinking. But overall, suicides follow a trend, which is white males, never married, between the ages of 25 and 34, death by a firearm. Next slide, please. Substance abuse was also a main theme in not only the quantitative data, but also the qualitative data. We have over 119 liquor licenses, and I actually think this number is a little bit of a low estimate of the number of liquor licenses in Gunnison County, and roughly 11 recreational dispensaries. So access came up as a theme in key informant interviews. It's just highly accessible. It's everywhere. We live in a place where people come to vacation and party and let loose, and that culture kind of seeps into the everyday culture living of locals. Also, drugs have changed in our community. If you look at THC rates of marijuana, of the flower form of marijuana in the 1990s, roughly there was about 4% THC in the marijuana, and now dispensaries sell marijuana that has THC rates of within like 30% THC, or if you buy concentrates, it's over 90% THC. So the drug itself has changed over the last 20 years. We're also seeing a rise in fentanyl in our community, which is concerning as it's 50 to 100 times more potent than morphine. And it is also concerning that it's being laced in drugs. So people who are not necessarily trying to use fentanyl are sometimes taking fentanyl, whether it's through cocaine or methamphetamines or even being in marijuana. And so that's when we're seeing overdoses in our community, and that has been on the rise as well. A portion of people just distrust governmental agencies to help them get sober. That's why organizations such as AA are so integral to helping people maintain sobriety in our community. I think living in a rural community, sometimes it attracts people who do not trust the government, who do not want anything to do with government. They don't want to be involved. Even people who are on probation sometimes just go through the process of getting help only so they can start using again. They have no interest in seeking help from some of these services. So thinking about how we can diversify helpers in our community so we're not just offering services from organizations that seem like they're governmental or sterile, I think is an important thing to consider. The community favors heavy substance use. Through the community survey conducted in 2017 and in 2020, it became evident that our community thinks that we are highly, alcohol use and marijuana use are highly acceptable in our community. And that's concerning for how it impacts youth. If adults are modeling a behavior of heavy substance abuse in public or at home, that can have an impact on how our youth choose to use substances in our community as well. And the last piece is the community lacks treatment options for substance abuse issues. So we don't have any sober living houses. We don't have an intensive outpatient. The hospital has started medically assisted treatment services, which has been, I would say, a success. They've had over, I think last year they served over 60 people through the hospital getting treated for their substance use disorder. So I think the hospital is going to expand on that service, which is huge, but thinking about what services can we provide in our community so people are not having to leave the community to access services. And then if they do have to leave the community, how are we going to reintegrate them in the community so they're not returning to places that got them in trouble in the first place, which is, I think, a large reason of why we're seeing such a high rate of recidivism, or why we are seeing recidivism. I wouldn't say a high rate of recidivism, but a rate of recidivism when people come back to our community. Barriers to access. Stigma definitely came up as a theme across a lot of the key informant interviews, but this is why I think diversifying helpers is so imperative. When someone from the core community recommends the food pantry to someone else in the core community, or when someone from AA recommends AA to someone who's struggling with substance abuse, or when someone who has gone through the process of receiving mental health help, getting correctly diagnosed and put on the correct medication, and then goes back out into the community and works on destigmatizing the very people that stigmatized her into not receiving help for 7 years. That is far more important and far more powerful, I think, than working on or marketing campaigns. But we also do have these Mental Health Matters, destigmatizing campaigns from Crescent Butte State of Mind, which is working to really normalize the conversation around seeking help for not only mental health, but substance abuse issues. And the more that we can continue to have those conversations openly and people can tell their stories about their experiences of seeking help, that will encourage more people to access services. But as that goes on, we need to think about how we can continue to expand upon the services and meet the need that we're going to see, or that we are seeing and going to continue to see in our community. And another important piece is when we're making decisions about what kind of services to provide or how to allocate money towards behavioral health initiatives, it's imperative to have people with lived experience at the table or their voice being heard in those conversations so that services or access to services or the ways that people are accessing services is meaningful to the people that are going to utilize them. And that really can only be done when their voices are at the table or when we go to their table and talk about what their needs are and how we can integrate their needs into what we want to provide in our community. Okay, sorry. Next slide. And I just want to, can you go one more slide? I just want to maybe leave you with 3 questions of how do we decrease costs, housing insurance, and increase incomes across our community? What programs or services do we need to expand upon? And how is it going to, how much is it going to cost and how are we going to pay for it? There are models used in other communities such as San Miguel, Summit County. They have worked to address behavioral health in different ways. And so how can we look to what other communities have done to come up with solutions that are going to work for our community members? And I guess with that, I will be done. Are there any questions?
Is there anything you're seeing in other communities that's different or surprising or?
As far as data or what they're doing to address the problems?
The latter, what they're doing to address the problems. I guess both, since you mentioned it, but mostly the latter.
I don't know about the data to be specific. I do know, to address the issues, some models that have been used, I think Eagle County, they came up with a list of top priorities of things that they wanted to address in their community. And then they figured out how they were going to pay for that. So they decided that they were going to do a huge fundraising campaign to raise $100 million. And then I think they're going to I can't remember, 2.5% sales tax. Don't quote me on that one, but San Miguel County passed a tax, I can't remember what specific tax either, to address behavioral health, and that money is going into a pool that is then allocated to different needs across the community. So I think we have a lot of the infrastructure in place, and like the Health Coalition, that is a great foundation for maybe some of that work, but maybe a tax or something like that is not what our community wants or will vote for. But just thinking about how can we address these issues maybe more collaboratively across organizations, so we're not just working in our own little silos trying to address these issues.
More in the full report, but I think a couple anecdotes on the line is there was a study that more information in the full report, especially in the literature review, which we didn't present today, that I think one statistic was the increase in alcohol. I don't know exactly how it was measured, but call it alcoholism in Southwest Colorado was greater than other parts of the state. And certainly there's facing other communities. One interesting piece of research that the county was, they took police data, they geolocated it, and they saw that a lot of the DUI arrests were occurring in a proximity from river takeouts. People were getting in the river and raft and drinking too much and then driving somewhere, and they use that information to course, and this gets maybe more at driving safety than the underlying, but that was I thought a really interesting use of data to basically law enforcement resources, specific locations at specific times to keep highways safer.
Michael had a question for you.
Yeah, a couple things. Preface was saying, I think one of the things that you mentioned is very relevant here, childcare. I know several people who use childcare or can't use childcare. And I think that's something that maybe we want to consider, because obviously there's bonds and taxes that go to the public schools, right? Or to the community schools. But there's, as far as I know, there's nothing really that go to, the preschool or the childcare places in town. And so, if there's some way that we can assist there somehow, I think that would benefit greatly, to the community. But secondly, I think in particular, your portions of the presentations, Jeff, where you talk about the economics and wages and things like that. I would like to see more relevant numbers, right? You stopped at 2019. You said 2019 because of the pandemic, and therefore, we're in 2022. That's 3 years, and in that time frame, we've seen restaurants close because they can't hire people, and people have increased their wages just for restaurant workers, in some cases twofold, right? Going from $10 an hour sometimes to $20 an hour. And so if we're using 2019 numbers, but then we're also floating 2022 instances of like you said, instances at Western and admissions and GVH, things like that, I think it's more important to have both 2022 income and economics to compare that to, so that way we can actually see, what's changed there. So just my opinion there.
Yeah, 100%. Yeah, the challenge. A couple answers. That one is we basically gathered the most recent, most available data we could at the time between, last summer and December, so the second half of last year, and census data, Department of Local Affairs data. A lot of these data sets really lag, that much maybe, but we are having a conversation with a potential funder who was very interested in the same thing. Like, let's, you gathered all this, we have 10 years, let's, twice a year, keep these that's updated so that months from now, come back and show you something more recent.
Hey, Jeff, I'm having a hard time hearing you. I don't know if it's the volume or how the mic's being used. Thank you.
Is that better?
A little bit.
I would, well, we definitely wonder and want the same thing in terms of the most current data for every data set. And if we did the best we could with what's available, that some of these agencies that collect it and distribute it or, lag that much. But there are conversations going to fund an ongoing kind of monitoring. We could also, conduct surveys, internally instead of waiting for the U.S. Census or, the state of Colorado to put something out. We could, get something done that would get you. I mean, I wonder the same things. I mean, the whole time writing a report, like, I wonder what it looks like now. I wonder what it looks like now. So that's, we could certainly talk about that more offline as well.
Yeah, I think that would just help us make decisions and provide better assistance, right? So, yeah.
I think you're one other comment about the childhood costs. We do see in the school data that we looked at that is in the report that the district-wide enrollment in K through 5 is declining over the last since 2014. And that's a net decline. So maybe people are moving here, but people are moving away. People aren't starting families. Kids are growing out of that age group. So on net, there's a decline. And, it does suggest that maybe people aren't starting families because of the high costs that John mentioned and you cited. Or they're starting families and then moving away. So that's the childcare is a real
Had a conversation, or in one of our initial presentations of this report, there was a restaurant owner in the crowd, and she said, "I want to pay my workers more, but the concern is if I pay them more, they're going to lose food stamps. They're going to lose some benefit that they might have because they're going to just make a little bit too much." And I think that's where we want to try to emphasize is those people living right above the federal poverty line, but below the self-sufficiency standard, where if they make just $1 more an hour, they might be making more money, but they're going to lose some kind of benefit. So in the long term, they're actually going to be hurt by getting paid more. So it's kind of this weird catch-22 of we want to pay more, but are we going to do more harm in doing that? So it's a larger systemic problem, I think, as well.
Let's hear Janet's got a
Yeah.
question.
Well, it wasn't a question, it was just a comment. I mentioned before that I had participated with a group of 30 people. I guess we're called the Collective Impact Group. And we meet again on the 26th to look at the solutions and ideas that were, all put up on sticky notes. But even in glancing at it before I sat down, that one of the high things was to do an across the board of organizations fundraising, instead of each organization trying to do their own fundraising, to do it collectively. And, I think that will be, one of the things that'll come out pretty high. But I'll report to you when we have our next council meeting on what we learned at that meeting that'll be on the 26th. Okay.
Anybody else have questions before we wrap up? All right, thank you both very much for the presentation. Very, very informative.
Yeah, thank you for having us, and I hope the guinea pig sound system was having us go first.
Yeah, cool. Thank you very much.